This is your retina. It is a collection of nerves and blood vessels. Since last 20 years, eye specialists have been using a machine called OCT to check if your retina is normal, swollen or distorted. OCT or optical coherence tomogram uses a special laser light to scan the retina. Conventional OCT can tell us if the retinal nerves are structurally normal or not, but it cannot tell us anything about the blood vessels in your retina. To evaluate the retinal blood vessels, eye specialists have been using a technique which is much older than OCT, the fundus fluorescein angiography. Fundus fluorescein angiography or FFA or DFA allows us to study the retinal blood vessels in great details, but it requires a dye to be injected. And there begins the problem with FFA. Patients who have to undergo FFA first and foremost have to tolerate an injection. Then there are few patients who are allergic to the dye. If there is an allergic reaction, it can have its own severe consequences. Third, the test is not advisable for people with compromised kidneys or pregnant females. Thankfully, now we have a safer and equally powerful tool to check your retinal blood vessels, and that too a test that requires no injection. This is OCT angiography. With time, as technology advanced, OCT machines have become faster and faster, and it is this extreme speed and advanced computing capabilities of the machine that allows us to study both the retinal nerves and the blood vessels simultaneously with the OCT angiography machines. The good news is that this technology is now being used in RIB every day thanks to our Heidelberg Spectralis multimodal imaging system. Let us now see few examples of how we use OCT angiography in day-to-day clinics. This is a 42-year-old female who is suffering from BRVO. She underwent multiple injections elsewhere but still had persistent edema. We, after seeing her, did an OCT angiogram, and the OCT angiograms clearly shows distorted foveal avascular zone. This is how a normal foveal avascular zone appears. As we can clearly see in our patient, the foveal avascular zone is distorted and irregular, which tells us that the patient is unlikely to gain much vision back. The second case was a diabetic. He was recently diagnosed with diabetic renal disease. He came to us because of difficulty in reading and writing. Since he had renal disease, we decided to do an OCT angiogram and avoided the fundus fluorescein angiography. And OCT angiogram clearly showed that there was loss of capillaries in the foveal avascular zone. This is a very common thing in patients of diabetic nephropathy, that along with nephropathy they also have retinopathy and associated macular ischemia. It is this macular ischemia which probably is causing the difficulty in reading and writing in our patient. The next patient was a 42-year-old female who complained of distorted vision in her left eye since 2 months, and OCT showed that there was fluid inside as well as under the retina. Now the OCT clearly shows the fluid, but from where is the fluid coming? The OCT angiography reveals that. The OCT angiography picture through the avascular zone showed a choroidal neovascular membrane. So, while the OCT shows the effects of the choroidal neovascular membrane, with the OCT angio, we can actually see the membrane. But wait, there is more. Now we know for choroidal neovascular membrane, injections are the way to go. With the help of an OCT angiogram, now we can actually see the effect of the drug on the neovascular membrane. OCT angiography is very different from fluorescein angiography. Fluorescein angiography shows us the area where the blood vessels are sick. However, OCT angiography can actually show us the sick blood vessels. This, along with the fact that the OCT angiography allows us to study retinal blood vessels at every layer, the superficial layer, the deeper retinal layers, and also the avascular areas of retina, gives us an unique way to study the retinal blood vessels, which we never had with fundus fluorescein angiography. And thanks to this unique tool, now we can actually see the effect of our treatment on the new blood vessels. So, we now have a new technology, that of OCT angiography, which helps us study the retinal blood vessels without having to give the patient any injection. By avoiding the injection, it becomes painless for the patient. Also, since we are not giving the dye, there is no risk of allergies. And it will be wrong to think that OCT angiography is a substitute for fundus fluorescein angiography. It is a unique test. It allows us to see the retinal blood vessels as never before.